If you're someone who suffers from recurrent UTIs, then listen up. This is something that I see very often in my clinic. Now, UTIs are typically caused by a bacteria called E. coli, and now they can be especially severe when the kidneys are affected. This can cause kidney damage, and it can actually even lead to sepsis. Unfortunately, with recurrent UTIs comes recurrent courses of antibiotics. Now, the issue with this is that although antibiotics are really great at killing the bacterial infection, they also cause an abundance of collateral damage, and they wipe out our beneficial bacteria as well. We need our beneficial bacteria to keep our defenses in check, and this is what actually stops pathogenic bacteria from being able to take over. Hence, the result is that these pathogenic bacteria replicate, and then the vicious cycle of reinfection occurs again. So what can you do about it? As I mentioned, UTIs can be very serious and they need to be handled promptly, and sometimes, most of the time, this requires that antibiotic intervention. But if you're noticing those recurrent infections, then what you do in the interim is just as important. What we can do here is change the environment, break the cycle, and then prevent a reinfection from occurring again. There are a few therapeutics that work really well here. So number one is lactulose. Lactulose significantly suppresses the growth of E. coli, and it also is a prebiotic that encourages the growth of lactobacillus, and lactobacillus is the predominant bacteria that reside in the vaginal microbiome. This is our beneficial bacteria there. Probiotics, so there are specific probiotic strains that have been studied extensively and shown to significantly reduce the recurrence of UTIs. These probiotics work by changing the environmental conditions so that E. coli can't survive in those harsh environments. Cranberry is an anti-adhesive, so what it does is it actually inhibits the adhesion of the bacteria to those mucosal surfaces. D-mannose, which works similar to cranberry, and what it does is it stops the bacteria from being able to stick to the urinary tract wall, and therefore it assists with that elimination. We have garlic. Garlic is antibacterial and specifically very effective against E. coli, as well as other very pathogenic strains of bacteria. And then we have a herb called Arctostaphylos uva ursi. Now, this is commonly known as bearberry, and what this does is it produces a compound called arbutin. Now, arbutin has been so extensively studied and traditionally used to treat urinary tract infections that it actually kills the bacteria involved in these infections. So there you have it, killing the bacteria, supporting the environment, feeding those beneficial lactobacillus species are what are going to actually stop that vicious cycle of recurrent UTI infections.